So I'm really pleased to welcome today the new Minister of State. I think we should be grateful for two reasons, I think. Firstly, it's only Karen's second week in the job, and I think she's really game in accepting our invitation to come. So thank you very, very much, Karen. And secondly, we're also blessed because Karen's worked in the National Health Service, so has long experience of the service. And I think that's just so relevant, isn't it, to a minister coming in, particularly at the moment. So Karen is going to speak for a few minutes, and then we're just going to have a discussion between us on stage. So I'm very pleased to welcome to the stage Karen Smith. Thank you.
Thank you so much. And first of all, my apologies for sort of jumping around your schedule today. A combination of London traffic and AI letting us down, just to be on message, meant that all had to be moved around. But I do hope that that's not interfered too much with yours. But look, I'm very pleased to be here to accept the invitation. It is my first outing, a speech as the new Minister of State in this new Labour government, so be gentle with me. But I was very keen to get out. It's sort of working day 9. In fact, 2 weeks ago today exactly, I was on a beach in Weston-super-Mare, having made a daft journey from Bristol on the off chance that we might do quite well in Weston-super-Mare, so I took two teams down there. So it's been quite the whirl, and sort of hitting the ground running, as the Prime Minister says, but being out and about, continuing to talk with the sector to understand what people are seeing and hearing is really important to us. So I'm really pleased to be here, and with the Health Foundation, who I know of old, because you are asking some of the most pressing questions in healthcare about harnessing artificial intelligence, strengthening our workforce and eradicating health inequalities, all of which is really important to us. And if you ask technical questions later, you will find out that I am no expert on this field. I do recognise and the points particularly made in the recent report on the opportunities and challenges. And I was able to just catch up on the last few moments of your last really excellent panel, because that report highlights exactly the priorities that I think we should be focusing on: giving patients and the public a voice in decisions about AI design and deployment, upskilling staff and healthcare providers so they, and most importantly, patients, can make the most of AI, and making sure industry gets a clear view of what the NHS needs and how to navigate its regulations, standards and obligation. Now, of course, this will require changes to the way we do things, but along with the service, change is the mission, in case you didn't get the message, that drives this government. We were elected on a mandate to fix our broken healthcare system, to deliver economic growth and to usher in a decade of national renewal. And harnessing the power of AI will be vital to driving change and keeping all three of these promises to the British people. For too long, we have worked under the illusion that we can muddle our way through, each crisis worse than one that came before. And the truth is, we really can't afford to do that anymore. There can be no more business as usual. And as the Secretary of State made clear, the NHS is broken and we are determined to fix it. The backlog in secondary care stands at above 7 million. The most recent figures show over 1.5 million patients are waiting for a diagnostic test in England alone. And our NHS is crying out for modernisation to do away with the printers, fax machines and 7 passwords for one laptop. That is why we must change. And this is why harnessing AI can drive that change and help to bring our analogue health service into the digital age. We will raise productivity by delivering on our manifesto commitment to introduce a new Fit for the Future fund to double the number of state-of-the-art CT and MRI scanners. Diagnostics, as many of you online here today and in this room know, this is an area where AI can make a real difference to patients. It can help diagnose illness earlier, treat it faster and save thousands of lives. We will also use AI to diagnose structural problems in the NHS itself. It is disgraceful that in Britain in 2024, black mothers are still more likely to die in childbirth. This is a hugely complex issue and a myriad of factors are at play. But thanks to its ability to crunch through huge amounts of data, AI can start to spot patterns that are blind to the human eye. This could allow us to piece together the puzzle and make interventions that could save lives that should never, ever have been at risk. And these could be some of the rewards of a modern healthcare strategy. Now, I want to tell you about how we'll get this done and roll out AI to benefit patients and staff alike, starting with our most crucial asset, the workforce. That's our capability and our capacity to deliver. Now, as your report acknowledges and rightly recognises, we have to fill the gap in professional skills in our NHS while making sure clinicians are confident using AI, that they are sufficiently trained in its limitations so they can keep making the right calls. And I heard that discussion happening in your last panel. We will train leaders to understand all the ramifications of AI so that they have everything they need to manage complex changes across the healthcare system. Secondly, a precondition to embracing AI is the modernisation of NHS infrastructure from top to bottom. Decisions that have been delayed for far too long. Now, I completely understand how staff will be frustrated by talk at the top of transforming the NHS with artificial intelligence when they're spending half the morning waiting for computers to switch on and start talking to each other. And I say to those staff, really, I do understand, I do share your frustration, and we can put this right together. Because as we modernise the NHS, I know we need to get the foundational stuff right, avoiding junk in, junk out, and slowing down those old terminals even further. Thirdly, we must change the way we fund and procure AI by creating a pathway for the very best technology that genuinely addresses fundamental challenges and patient priorities to receive consistent funding. That's why we will deliver on our manifesto commitment to develop an NHS innovation and adoption strategy. This will include a plan for procurement, giving innovators a clearer route to get their products into the NHS and into the places where they can make the greatest difference to patients. This demand was in the Health Foundation's report, and you are absolutely right. We will also introduce reformed incentive structures to drive innovation with faster regulatory approval for new technology and medicines that will benefit patients most, supporting the NHS to have the infrastructure, data and skills they need to deploy AI across the country. Meanwhile, this government, in case you haven't also got the message, will always ask how taxpayers' money is spent, in this case £170 billion worth in the NHS. We want to make sure that taxpayers' money is always spent more wisely and more productively. Patients and staff working in the system can see the waste, inefficiency and bureaucracy every day. Patients and staff are the ones that drive this work. We will crack down on this waste and use the savings to reinvest in our people and technology that cuts waiting lists of patients and gives patients better care. Now, I know every technology brings trade-offs, but we will work tirelessly to develop robust regulation and evaluation frameworks that will help, not hinder, innovation, speeding up decisions to get all patients the best technology in the world. The UK can set standards across the world for safe, ethical AI that balances innovation with a relentless focus on patient safety through robust but dynamic regulation, testing and evaluation. So let me be clear, this is not about reorganising the health service around AI to make our lives more complicated. This is about AI serving patients and freeing up time for staff. I will not be satisfied till I start hearing from staff how it's made their lives easier. And we also critically have to make sure the public are on our side. That's why patient safety and full transparency must be at the heart of everything we do. Now, I want to wrap up by saying that I am optimistic. I guess I wouldn't be in this role if I wasn't, but I really am. We can lead the world in healthcare innovation, but before we seek to change the world, we need to get our own house in order. Renewal begins at home. We need to get the NHS back on its feet and making it fit for the future. Changing the personnel behind desks at the Department of Health won't cut the mustard. If we are to be equal to the task of renewal, we will need to thoroughly change the way we think, imagine and deliver healthcare. And to do this, we will need the support of you all in this room and those of you online. And crucially, we need patients and staff to be with us. Repairing broken bitten will not be easy, but I am up for the challenge. I know you are too, and together I think we can do it. Thank you very much. all the mod cons.
And thank you for agreeing to have a few questions from us this afternoon. So I guess the first question is, how is it so far? And congratulations. Is it a whirlwind or...?
It is. I mean, I've been around elections for a very long time, so I've seen some changes going, but to be part of it, and to be part, as you alluded to, as someone who worked in the service previously, I mean, it's such a huge honour. It's a huge honour to represent a constituency like mine. But to be able to now work with the new Prime Minister and the Secretary of State, who I know very well and I've worked with closely over a long period of time, to do this is hugely humbling, but very exciting. And you know, I said I was in Weston-super-Mare 2 weeks ago. We had chips and then came home. And it really has been like that from day one. But we're so full of energy and enthusiasm for getting that done. And the advantage we have as politicians, which I sometimes don't think gets out, is that and because of all the by-elections that we had under the last government, I mean, I have been all over the country in the last 2.5 years at these by-elections, because we were all sent out to do that. The huge privilege that you have with doing that is that we have all talked with people behind their doors, because we knock on their doors and then we start talking to them, and they have talked to us. And coming now into this role in this department, I think we would all say that we do feel very knowledgeable about what people are saying. And the NHS was at the top of that list. So I know people look at polls and journalists and papers, but what I do, and I know what Wes does and what Keir does, because we all like being out, is talking to people, hearing those experiences, visiting systems, but crucially talking to people and hearing their experiences. And that's hugely empowering for us coming in. I think it's something we'll want to keep doing. We don't want to lose that being close to people. And crucially, the reason we could say we know it's a decade of national renewal is because people are very clear. First of all, they were cynical that we could do something, that we could make the NHS survive. I mean, some of you will know there was a conversation a few years ago about whether the NHS could survive, whether it should survive. We don't have that conversation now. Now we're having the conversation about how do we fix it? And everybody's up for that. And we need to bring the public with us. They know there are difficult choices ahead, but they know the prize is worth having, and the huge mandate from across the country, frankly in places we didn't expect to win, I think is part of that. And we want to keep having that conversation with the public.
Thank you. I mean, you mentioned there's a long list of things to fix. I think we all know that. And I also know, Karen, your brief is actually quite voluminous, let's put it that way. And technology and data are in there. So I'm just wondering, in your long list of priorities, where technology is, given the pressure to meet short-term things.
Well, I guess in this order, I have to say number one, don't I? That would be, you know, but we want to be really candid. Look, we know the biggest pressure facing us is our workforce. Is obviously money is always there. It's always there with the NHS. But the workforce, the morale, and you know this well, we know that morale is a real problem. Obviously, we have the worst legacy of industrial disputes under the last government that we've ever seen. That's a symptom of that morale problem as well, and the pressure. And that's why the Secretary of State is meeting, immediately. The doctors and the unions and so on because we recognise that. We've got huge problems with estates, with capital. I mean, you know, the list is, as you say, quite hard.
It's very long. And in terms of staff and morale, and you mentioned some of this in your speech, do you have any sense of demand signals or priorities that you think that AI and technology should be focusing on to help them in your time already in the last couple of weeks? Are you developing your priorities for technology?
Yes, and I've been public myself. I've been a patient in the last year, and so and seeing, you know, up front, from my previous career as a manager, and I was asked this. I did a talk to the IFG a few months ago, and I was challenged about whether staff were up for looking at waste and inefficiencies in the system. Nothing drives a front-faced clinician more insane than you know, trying to get computers to start up, to talk to each other. And I mean, I do think we've got a generational shift. When I worked trying to introduce some technology into systems sort of 14 years ago, the radical idea that you might take a photograph for dermatology and send it into a hospital consultant, and they might look at it and it might help with waiting lists. Enormously difficult to get GPs, secondary care, the industry, the data, the money flows, to all recognise how that might help patients, and the confidence, as I said in my speech, the confidence, and you talked about in your last session, of clinicians and patients to trust it. That's a huge task, and it certainly was a huge task sort of a decade or so ago. Now we have a generation of people, you know, I mean, I'm 60 this year, much younger than me, and so on, that are using technology every day. We expect things to work, we expect things to, you know, we go shopping, we expect all that sort of stuff. They are used to using it, so if they're not using it in their professional life, they get more and more frustrated. So they are willing participants to make this work. I mean, I've been in a hospital recently for a 10-minute specialist appointment, half an hour for them to go around to try and print off a letter to tell me when my next appointment was.
Right.
You know, that is the day-to-day reality. 10 minutes of really expensive, high-quality clinical time and half an hour to print off a letter. That's just not okay, is it? And then other times getting things through on the app and things through on your phone and so on. The inconsistency for patients. So to answer your question, it is like, and I was impressed by your last panel, and the rest of your time is really well spent. It'd be interesting to hear how it goes. Absolutely, you have to have patience. Patients are ready to have that. They want that to see. But staff, we can help them, get it right for them. They're the ones that are seeing this greatest inefficiency, and they use it in their normal lives. Getting to work and not having it, it's not acceptable for them either. So I think we have an opportunity, and we need to go with it.
Fantastic. And perhaps if I can ask one last question before I let you go, Karen, and that is, I mean, if money is tight, public money, we all know that, is tight, there could be a tension, couldn't there? I mean, in that Wes Streeting has said, quite rightly, he wants the NHS to play a part in Britain's prosperity and growth. And a lot of that prosperity and growth might be down to scientific and medical interventions and AI and technology that are good in of themselves, and they may generate funds for GB plc. But actually the things the NHS needs may not be necessarily those things. They may be to do with just the things you mentioned, stopping the things that make clinicians go nuts, to do with non-clinical applications. So in a sense, how do you sort of make sure that the priorities for the National Health Service and its sustainability get a look in when there's a big push also towards, quite rightly, towards growth and science and discovery using AI? And using the NHS to exploit that. I
mean, it's a big subject for a 30-second response, isn't it? But I don't see the two things as separate. And what Wes Streeting was identifying, and I think we again see this as local constituencies, members of Parliament, we both represent areas of high deprivation. I always say to people, the NHS, the care system, is a fantastic place to work. There are huge opportunities. The people that are there in our country that don't have the skills, they're not earning the money in order to be able to support themselves and their family. That's where you drive growth in local communities with people. We can help them into those decent jobs of the future, and that does involve adopting lots of technology, different ways to train people. You know, I mean, I understand there are thousands of people online to this conference. You know, right. The days of us all, you know, trudging to London to do things are rapidly over, aren't they? In only the last few years. We have to be thinking, and we want to set a very clear signal about growth and what it means for all those thousands of people that we go and see and knock behind their doors, the waste of human potential that we see in our constituencies, how they can be used in order to get the jobs, the careers of the future. They are there with the solutions as well, and we want to absolutely harness that growth in those communities. That gives them better health. Yes. It stops them with those terrible lifelong disabilities. The health inequalities agenda, we see it as part of the same thing. So I don't separate them off. That is probably the subject of a thesis at some point rather than my short reply. But that's our vision. We want those people to be part of the solution. We see that as the fundamental part of growth, and that's what's going to make the NHS fit for the future and make sure it thrives into the rest of the 21st century.
Thank you so much, Karen, and I'm hoping that maybe you'll come back and speak to us next year and develop that thesis with us, because we're certainly all behind it at the Health Foundation.
Keen to keep the conversation going and look forward to the rest of your conference.
No health, no wealth, right? Exactly. Many, many thanks. In your busy schedule, we'll let you go now. Thank you to both of you.